Hello. Today we are going to be going through the process of performing a community needs assessment. My name is Lauren Diapoli. I have a bachelor's degree in social work, and I have experience in case management with nursing home residents and special needs children, specifically with special needs children doing direct service work, and then in nonprofit group homes with mentally disabled older adults and at-risk inner city youth. Currently, I'm a graduate student obtaining a master's in applied nutrition at the University of New England, and I'm working towards becoming a board-certified nutrition specialist. I have here a map of New York State. We're going to be focusing on this circled community right here, which is Southwest Suffolk County. Just for reference, this is Queens. This is my hometown. Right below that is Brooklyn and Staten Island, and right above it is Manhattan and the Bronx. Today we're going to be going over the community of interest I've chosen, my target population, assessing the problems that they're facing, findings from key informant interviews, an analysis of that data, and then intervention proposals. Suffolk County, New York is an extremely socioeconomically diverse area. It's this red region right here of New York State. Numerous celebrities take residence on the east end of this island. Some names are Leonardo DiCaprio, Sarah Jessica Parker, Madonna, Jay-Z and Beyonce stay out there for this summer, Alec Baldwin, Julie Andrews. This is just to mention a few. But this is only the end portion of the county. I'm focusing here on this area right here. Addressing this community's health needs, it's vital to look at the underserved, socioeconomically disadvantaged portions of the county to really assess where we're most needed. In 2014, the southwest portion of Suffolk County had approximately 500,000 residents. An estimated 23% of those residents were on Medicaid and 13% were uninsured. Southwest Suffolk County residents reported difficulty accessing healthcare, high prescription costs and physician visit costs, inconvenient office hours, lack of transportation, high diabetes prevalence, poor overall health status, and low fruit and vegetable consumption. I'm looking at this portion here. It's just slightly outside of Babylon as well, so it includes Babylon and some of the surrounding areas. Sadly, the lowest income neighborhoods in this area have the highest minority rates. Wyandanch is one particular town in this area. It has approximately 61% African American residents and 31% are Hispanic and Latino. Wyandanch has an uninsured rate exceeding 20% and a median household income of about $57,000 a year. This is extremely low, especially since Suffolk County is commonly called one of the most expensive places to live in America. In order to qualify for New York State Supplemental Nutrition Assistance Program benefits, the maximum annual income level for a family of 4 is $31,000. This means that the average family in Wyandanch and other low-income communities in Southwest Suffolk County would not qualify for SNAP benefits. This population is commonly living with food insecurity, has limited access to inadequate health care, and this is putting them at a greater risk for increased health disparities. So it is quite unfortunate that they don't even qualify for SNAP benefits. But it is true that pregnant mothers would be able to get WIC benefits. The population targeted for this community assessment is women ages 18 to 35 who are living within the southwest portion of the county. Socioeconomically disadvantaged young women in this area may lack adequate health care and face food insecurity, as I previously mentioned. These are childbearing age females, so this not only affects their own well-being, but can also negatively impact the health of their children and families. Low-income women with children are commonly affected by high perceived stress levels, which is positively associated with unhealthy eating behaviors, and therefore they're at a higher risk for severe obesity. Food insufficient households have higher rates of diabetes, high blood pressure, and heart disease. Through key informant interviews, I sought to determine what the primary health complaints of females ages 18 to 35 who are living in Southwest Suffolk County are facing. I was interested in seeing whether health professionals could link common health disparities to inadequate dietary intake and/or obesity. I contacted 2 registered nurses who work in hospitals that serve lower income neighborhoods, one of which is the Martin Luther King Jr. Health Center in Wyandanch, and another is the Good Samaritan Hospital in Bayshore. Nurse number 1 reported that obesity and poor dietary intake had a negative health impact on health of females 18 to 35. She saw this as the biggest problem. She said that an increased nutrition education and information on how to access healthy foods would really benefit this population, and to her knowledge, no nutritional education or information was offered to these patients. Nurse number 2 reported numerous different health disparities, but most of them could be related to obesity and poor dietary intake. On average, she said that females 18 to 35 were not intaking a nutritionally sufficient diet. She said that this population would benefit from nutrition education and information on how to access healthy foods. Based on this nurse's intake assessment, a patient could be referred to a nutritionist for a consultation, and she mentioned that interpreters could be used as needed, but if a patient did not express a specific nutrition-related condition, the patient may not actually see a nutritionist. While the first registered nurse immediately noted obesity as the primary health concern she saw in her medical setting, the second registered nurse had a large list of other health conditions, as I mentioned, but as I previously stated in the last slide, a lot of those concerns, besides substance abuse and nicotine addiction, could be related to poor dietary intake. The overall theme of the key informant interviews was that there is a lacking of and a significant need for nutrition education and information on how to access healthy foods. My proposed intervention strategy is a social media marketing campaign due to the young age of my population of interest and the popularity of social media. It will use evidence-based approaches to educate on adequate nutrient intake. It will seek to improve fruit and vegetable consumption, specifically intaking 5 or more servings of fruit and vegetables daily. It will highlight the benefits of increased physical activity, and it will inform individuals of why they should decrease fast and fried food intake and sugar-sweetened beverage consumption. I'm also proposing to increase access to community resources like SNAP and WIC benefit office information and food bank locations. As I mentioned, some individuals in this area may not actually qualify for SNAP benefits, so a long-term strategy would be to enact changes that could increase the minimum income for SNAP qualifications, but in the meantime, just increasing community resources like informing individuals where they could go to food bank locations would be a part of this intervention strategy. I have 2 listed here. One of them is Long Island Cares, and it's a number of different food banks on the island, and the other one is Island Harvest. There's a lot of other intervention strategies that could be enacted that would benefit this population and their families. As health professionals, continuing to address the unmet needs of the underserved populations in our communities should be a priority. I hope you found this community needs assessment informative and interesting, and thank you for watching. Here are the references that I used to create this presentation. Thank you so very much for watching. I hope you have a great day.